Okay, well, thank you for joining me tonight on this November night, just a week or so, a week before Thanksgiving. The year went fast, and what a year it has been. I'm Victoria Liotta, and I'm a doctor of acupuncture, and I'm licensed in both acupuncture and massage. And tonight, I'm going to be talking about carpal tunnel in particular, but also other pain in the hand, wrist, arm, even maybe the shoulder area that people experience. And I chose this topic because so many times people come in and they say, I have carpal tunnel, and they point to their hand. And the first thing I ask is, well, how do you know? And they tell me, well, I have hand pain and I have tingling in my hand or numbness in my hand. And I usually say, well, it might not be carpal tunnel. Let's not jump to conclusions because carpal tunnel can be severe and it's kind of sneaks up on you and it can be troublesome. And sometimes you might need surgery. So I like to investigate a little bit before we talk and just say you have carpal tunnel. Because it could be many other things. And that's why I titled this Carpal Tunnel, True or False. Now, when I say carpal tunnel, I really am talking about carpal tunnel syndrome, because the carpal tunnel is just an area in the wrist area. And I'll get to that in a moment when we talk a little bit about anatomy. So what is carpal tunnel? The carpal tunnel syndrome, I should say. Well, we've all heard of it. And like I was saying, many people think that any hand pain or wrist pain is carpal tunnel syndrome, but it's more specific than that, okay? Because you can have many other things that are causing hand pain. It could be, like I said, related to your neck, shoulder, your, a forearm. But specifically, carpal tunnel is a compression of a nerve called the median nerve, and I'll get to that in a moment, specifically in the wrist area. And it is so insidious. It kind of like you start having maybe a little achy pain and you're not really sure if it's going to last. It might disappear for a while. You might wake up with numbness in your hand. But it's usually caused by repetitive action or repetitive motion. Okay. And I'm glad to see that some of my musician friends are online watching now, because musicians frequently get what I call true carpal tunnel, because they tend to practice a lot and perform a lot, and they use the same motion over and over, just like a guitarist would hold a guitar neck and make chords over and over and keep their hand or wrist bent in what we call flexion, where the palm is flexed or bent towards, let's say, upward towards the elbow when you're looking at your palm. Other musicians too. I've been playing drums for 40 years. And I've been avoiding, wrist pain and carpal tunnel and elbow pain. I've had little hints of things, and I always try to stay on top of it. And I'm going to show you some exercises and give you some advice of how to avoid, more severe injuries. Let's put it that way. Athletes too can get carpal tunnel syndrome and arm pain. It's all about that repetitive use. Here, just typing. All of us in this COVID age, we've been working at home. Many of us have been working at home. If you're a teacher, you're typing more. Your lesson, you're teaching your lesson basically online. You might be typing in the chat box more often. You're hunched over a computer. Many of us type in our jobs anyway. Used to be, back in the day, it was just administrative assistants and secretaries that needed to learn how to type and type on a regular basis. Now everybody knows how to type, and everybody types one way or another through their day or through their, in their life. So just that daily, typing can cause carpal tunnel and just wrist pain in general because of the way your hand is bent and the use of the fingers, the repetitive use. When I say repetitive use, like I said, it's just that same action over and over again. Hairdressers I've had come to me saying they have pain in their hands. It just makes sense. They're using scissors all day long, for days, weeks, years upon ends. They start getting cramps in their hands. They're afraid of developing carpal tunnel syndrome. But there's things that we can do to prevent and roll back the pain. And I'll talk about that a little later. Playing sports, like I said, any repetitive action, back before mechanical, screwdrivers, uh, construction workers from, like, just the motion of turning a screwdriver would get wrist pain, or, even leading to carpal tunnel. So there's many things that could lead to carpal tunnel, but they usually are repetitive use syndrome. It's a repetitive use syndrome is what I'm trying to say. It's from repetitive use, doing the same action over and over again. And the symptoms: numbness in the hand. Of course, you might wake up with numbness in your hand and maybe a tingling feeling that you might have to shake out for a minute. You have numbness in the day in the fingers, okay? You could have pain, of course, that achy feeling. With carpal tunnel, I think it's just like insidious, they say, where it just could be kind of an ache that comes and goes and kind of gets worse over the years. You could have a shooting pain. Whenever you have a shooting pain, it usually is due to some issue with a nerve, okay? And you could have weakness in the hand. The weakness usually comes a little later, down the road, if you don't take care of the symptoms you're experiencing. So, many of us complain about, it could be a sharp pain, it could be, a dull pain. And like I said, it could be carpal tunnel, it could be something else, right? So, moving on, I want to just talk a little bit about the bones of the hand and, the structures. We see an X-ray here. And the hand's made of many different bones. So it seems like when there's the more structures, the more things that could go wrong, especially when we use our hands, for everything throughout the day. They're more vulnerable than, other parts of the body, and we miss them more so. So if you look at this picture, we'll start with the phalanges. Those are the fingers, okay? And you can see the different knuckles. There's 3 sections of each phalange, except for the thumb. And the phalanges are connected to the metacarpals. Those are those bones that follow, that are more so in the palm of the hand. And in this picture, below the metacarpals, we find the carpals. And that's where carpal tunnel syndrome gets its name from, because the carpal tunnel is a space. They say it's a concavity. It really is like a tunnel, and it's formed by 4 of the carpal tunnels, specifically the pisiform, the hamate, and then the scaphoid and the trapezium. So they kind of line up like, 2 by 2, 2 on either side, and there's a tunnel between them. And when that tunnel is compressed, it can cause true carpal tunnel syndrome, okay? And there's a nerve that goes through that called the median nerve, which I'll get to in a moment. Attached to the carpals are the ulna and the radius that form the forearm. The ulna is on the pinky side, the radius is on the thumb side. And of course, the hand has muscles in it so that we can move our hand. We have tendons and ligaments. Tendons attach muscle to bone, ligaments attach bone to bone. So there's a lot of different structures in the hand. And I want to talk about one in particular, which is called the flexor retinaculum. And this is important because it is like a tendinous type of structure that wraps around the wrist, and the flexor part would be on the flexor side, which is the palm side, okay? And it's the palm side of the wrist, and when this is tight, it can compress on the nerve associated with carpal tunnel, which is the median nerve. And that would be true carpal tunnel. Now, the median nerve, like I said, is very important, because when the median nerve is affected at the flexor retinaculum, where the wrist is, I'm trying not to get too technical, but when the median nerve is irritated or compressed or pinched down by the wrist area, it really is true carpal tunnel, okay? But the median nerve, like many nerves, isn't just at the wrist or the hand. It actually starts in what we call the brachial plexus. Brachial meaning arm, plexus meaning like a bundle of nerves, okay? And it comes out of the brachial plexus, specifically from the C5 to T1 level. It goes through the shoulder and then down the upper arm, into the forearm. I wrote anterior forearm, which is like the palmar side. When you look at your palm, the forearm side there is considered anterior. And through the flexor retinaculum at the wrist, and then through the carpal tunnel, in between the carpal bone. So that's the pathway of the median nerve. And I brought this up. I'm bringing this up because you could have tingling or numbness in your hand or pain in your hand, but it's not necessarily coming from your wrist. It could be coming from other areas where the median nerve travels through. It could be back at the shoulder area where the pectoralis minor is, okay? That's in the chest. And this muscle, when it gets tight, can compress on the median nerve and cause some pain, achiness down the arm. You know how they say, they say with your neck, like, well, if you have a herniated disc, you could get numbness or tingling in your hand. Same idea, but it's in the shoulder area near the chest, okay? So as the median nerve passes underneath or through the, through the pec minor area, the pec minor is tight, let's say from holding a book bag or your pocketbook, or from doing bench presses, or even from being a little round shouldered, the chest gets tight. You could press on that nerve and cause those symptoms down the arm. Same thing can happen in the forearm with pronator teres. Pronator teres is in the forearm, and it often gets tight with activities such as playing racquetball, ping pong, because what you're doing, you're pronating or turning your hand over. Your palm pronation means when you take your palm, you look at your palm and you turn your hand down, okay? There's a muscle that specifically does that, or several muscles that do that, and one of them is pronator teres. And when you're playing racquetball or ping pong and you're flipping your hand when you hit the ball, you keep doing that, you're going to get a repetitive use syndrome, but it's going to be related more to the forearm. And you might end up with trigger points, or what we call knots in the forearm, tight muscles, and that needs to be addressed. But it's still the median nerve that's affected, or the pronator, but in the forearm muscles are pressing against the median nerve and causing that tingling and pain and achiness into the hands. Okay, so there's different things that could cause hand pain. So when someone comes in to visit me, for an acupuncture treatment, they say, well, I have this hand pain. It's not, I tell them, it might be from your hand. It could be a combination of things, but the first place I usually look is, see what their posture is like as far as their musculature in their chest, if it seems real tight in the chest area or their shoulders turned inward. I might work in that area, or I specifically find a lot going on in the forearms. Usually the forearms is the first place I go to, okay? But just by releasing and relaxing the muscles of the forearm, the pain tends to diminish, or at least decrease, little by little. All right, looking at the median nerve again, I put this slide here because it shows specifically the fingers that would be affected as far as numbness when you have true carpal tunnel, okay? So I hope I'm not jumping around a bit, but I wanted to put this slide here because I want to talk about how we diagnose for carpal tunnel syndrome specifically. So you see the thumb, the index finger, the middle finger, and half of the ring finger. That's where the median nerve comes through the hand. So it comes through the carpal tunnel and then it branches off into these fingers. Okay, I don't have a picture to show the nerve, but if someone comes in or you're experiencing numbness in these fingers, it's a good chance it really is carpal tunnel syndrome. Okay, but there is hope. There's things that we can do as long as it's not too advanced. Then I would send you to a hand specialist, but we won't go that far down the road. But this is the pattern of the fingers that would be affected specifically, okay? It's real specific, with carpal tunnel syndrome. And there are other tests that practitioners such as physical therapists, acupuncturists, massage therapists, doctors would do to see if you have carpal tunnel syndrome specifically. And these tests have been around for decades, still use them today. So when someone comes in with wrist pain, arm pain, hand pain, and we suspect carpal tunnel, I go through these tests with them, and they're very easy to do. You can see First one is just thumb opposition. You take your thumb, move it across to your pinky, hold it there. And I would just test the strength there. So I would say, try to resist my finger as I try to, pull your pinky and thumb apart, just with a little bit of pressure. If there's strength there, test is negative for carpal tunnel. Another test I would do is called the Phalen's test or the Phalen's maneuver. And that's where the person would take the back of their hands, put them together. So their hands are bent in flexion. That's considered flexion. And if it mimics the symptoms they're having and, like numbness in the hands or pain, it would be positive for carpal tunnel syndrome. If they don't, it's negative. And the last test that I would do is the Tinel's test. And whenever you see Tinel's, there's usually a tapping involved. And you can see in this picture, there's a person tapping on the wrist area. Okay, so you tap over the carpal tunnel. Actually, the finger should be a little higher, more into the wrist area. But when you tap there, if I tap on someone there on the wrist, if it elicits like a shooting pain or pain into the fingers or the hands, then that would be positive for carpal tunnel syndrome. I just want to see one thing. Okay, so all these tests are orthopedic tests that are done for, to prove if someone has carpal tunnel syndrome or not. And just bear with me a moment. Okay. Other diagnostic tests that can be performed are x-rays to see if there's broken bones or even arthritis. A doctor can, write a script for an MRI or an ultrasound to see if there's swelling of the median nerve. And it's interesting, sometimes pregnant women are diagnosed with carpal tunnel syndrome because there might be a swelling in the hand that would swell the area of the carpal tunnel and cause, that pain and numbness into the hand. More sophisticated tests are the nerve conduction velocity test and the electromyography. Those are tests that probably a hand specialist or a doctor would prescribe, and they're a little bit more sophisticated, and they would determine the effects, how the nerve is affected or not, and how well the nerve is working. And those are general nerve tests, by the way. So, it really could be something else if we do these tests and we find out you don't have carpal tunnel. When I say carpal tunnel, I mean carpal tunnel syndrome. It could be tendonitis, which is not anything to disregard. Tendonitis can be severe and cause a lot of pain and discomfort. Basically, itis means inflammation, and tendon is the tendon, so it's inflammation of the tendons. And that's also caused by, repetitive use, sports, any, repetitive action, injuries, and it can be addressed through, specifically, different, some people like physical therapy, some people like acupuncture. Also, you could have hypertonic muscles. Hypertonic means tight muscles. And if those muscles are tight, they need to be worked out. They might just be, everybody knows when you have tight muscles, there's an achiness to them. So it might be as simple as just getting some acupuncture massage, using a little heat therapy. And I also mentioned pectoralis minor and pronator teres can be affected, causing that achiness if those muscles are tight. And what about trigger points? You might just have some knots in there, from just an injury or just, stress. The muscles get very tight and they form little knots. We think of trigger points and knots as being in the back or the neck. You can have them anywhere there's muscles, and those can be worked out specifically with acupuncture, and massage is very effective. So, if it's something simpler, it might not be, you might not need surgery, okay? It might not be carpal tunnel where it's so advanced that you have to, run and have surgery. There's things that, other things that could be happening that are simpler and that can be taken care of in a few sessions. I wanted to show this stretch first. So I talked about doing stretches, and this stretch is very effective. I'm looking at the picture on the right-hand side, and it was shown to me by a physical therapist back about 10 years ago. And excuse me, I just want to see something. Okay. It was shown to me by a physical therapist many years ago for the achiness that I was experiencing in my hand and my forearm. And I still do this stretch to this day. And it's wonderful. And it affects you. It stretches the hand, the wrist, the arm, all the way up, to the axillary area, which is the underarm area. And I find it to be life-saving, really. So how you do it, you can look at the picture here. You take your palm, or actually the first thing you do, I would say, lift your arm up to about shoulder height, and then put your palm against the wall, and you should feel a stretch. If you can't get your entire palm flat to the wall, what you can do is just do the best you can with it. Maybe just your fingers, a little bit of your palm. I don't want you to hurt yourself, but until you feel a stretch, okay? And then hold that stretch for about a minute. It's great doing this while you're watching TV. A commercial or two is a perfect amount of time. You'll feel just the muscles. The stretch goes where it needs to go. You'll feel the muscles in your arm open up. And if you don't feel a stretch when you do this, just turn a little bit away from your hand, just a tiny bit, until you feel a stretch. All you have to do is feel a stretch and then hold it. And this, like I said, this is very effective for tight muscles of the arm that could be causing that achiness. If anybody's interested in learning more or how to do this stretch more specifically, just give me a call and I can show you in the office. But I hope I described that, where it's useful. Also, moist heat is wonderful for achy muscles. What I like to do, and what I tell people all the time, is take a hand towel, wet it, wring it out, roll it up, put it in the microwave for about 30 seconds, take it out. If it's too hot, shake it, wrap it around your forearm, your hand, your wrist. You can massage it in, and the heat won't last a long time, but if you repeat this 2 or 3 times, I find it to be very effective in relaxing the muscles of the area. Some people swear by ice. As being trained in traditional Chinese medicine with acupuncture, we never were taught to use ice, to be honest. They always talk about heat. Probably because back 2,000 years ago in China, they didn't have access to ice like we do now. But physical therapists, I know, and more Western medical doctors will recommend ice. I say if it works, go for it. But I prefer, actually, if you're going to use ice, I would say use something called contrast bathing, where you start with the moist heat or heat on the area. And then after about 30 seconds, a minute, then you switch to ice, and then you go back to heat, ice, about 3 times or so. And always start with heat and end with the ice is the best way to do it. Okay, so those are some things you can do at home, but the stretch, I'll tell you, works wonders. There's always the wrist brace that works very good. This is good for keeping that numbness away, keeping the swelling down, because it also acts as, it has some compression and a compression aspect to it. And I find that it keeps the wrist in neutral position. I had talked earlier about when the wrist is in flexion, how it can cause, that carpal tunnel or the pain in the forearm. So you can see with the wrist brace, it'll keep your hand more in line with itself, okay, with the hand in line with the forearm, so it's considered neutral, okay? It's not bent forward or backwards. You can wear it during the day, wear it while you're driving, and also if you tend to wake up with your hand numb or your arm numb, it's good to wear it in your sleep, and you don't have to wear it every day. I find if my hand's a little achy, If I just wear it for a night or two, that's fine, and I'll be fine for a long time. But anybody who uses their hand as a body worker probably has had to use a wrist brace at one point or another during their career. And like I said, I don't find I have to use it ongoing. It's just something there that is handy and helps. And then, of course, I'm an acupuncturist, so I couldn't end a webinar without talking about acupuncture. And acupuncture is so effective, and research shows that it's very effective too, not just by what I'm saying, but there's plenty of research that shows that acupuncture is very good and effective for decreasing pain and healing from injuries. Acupuncture, for those of you who have never had it, is the use of very fine needles to manipulate energy, which we call qi. You've probably all heard of qi. And the ancient Chinese believed, and they continue to believe and teach in acupuncture, that qi runs through channels or meridians throughout the body, through the legs, the torso, the head. You can see the lines here are channels, okay? And that's where the qi is distributed, even up and down the arms. So in the case of pain, we want that qi to be flowing smoothly and effortlessly through the channels. And where there's tension or a blockage, or what we call stagnation, there can be pain. So we want to remove the blockage from the channel so the qi can flow smoothly. And that's basically how acupuncture works, okay? That's a little acupuncture 101, but anybody who's interested in an acupuncture session, I'd be happy to explain things further and see if it's right for you. So you can contact me at Inner Source Health. That's where I work. And the numbers here. We have something that we call a discovery session. It's a 10-minute free call where you could ask me questions about acupuncture and how I could help you for whatever condition you have. Or if you have questions from tonight's webinar, you can email me here at victoria@innersourcehealth.com, or feel free to come on social media and see my posts. And I have my Facebook addresses here, my Instagram addresses here. You're welcome to follow me. I think we have a couple of questions. Let me see. Okay. Here's a question. Does the repetitive use, getting back to the repetitive use that causes wrist pains and specifically carpal tunnel, it says, does the repetitive use have to be done over time before problems develop, or can problems develop in a short period of time? That's a very good question. Usually it's over a period of time, but if you're doing something like, very like for hours and hours of, let's say, playing guitar, and you're in a certain position and you're doing the same kind of action or motion, it won't take long before you start getting some kind of symptom. Carpal tunnel syndrome specifically tends to take time. It's a little more insidious, where it kind of sneaks up on you, and you might have some pain that comes and goes. You might have some numbness in your hand, but it's very important to address. So carpal tunnel usually takes I would say it takes a couple of years usually, but I can't really guarantee that. But you can see other problems, tight muscles, achy, soreness from any repetitive activity. So thank you for that question. There was a question related to that by someone who plays bass, and he said, how can I avoid the pain that I'm experiencing when I practice my bass? And I would say, take a break from it. I'm not saying don't play, but when you're practicing, if you're going to practice for over an hour, especially, or even an hour, practice for maybe 10, 15 minutes, stop for a moment, shake your hands out, do some stretching. Stopping the repetitive action in its tracks just for a moment helps. I would also suggest doing that stretch that I showed on the wall I don't know if I could get back there, but that is very helpful. Any stretching to the hands and the forearms would be good for that before and after playing your instrument. Okay, well, I think that's all we have for questions. Let me see. Okay, so thank you so much for joining me tonight. I want to wish everybody a happy and healthy Thanksgiving. And as I said, you're free to contact me with any other questions by email, or if you'd like to do a 10-minute call, just to ask some questions and see if acupuncture is right for you, I'd be happy to talk to you. Thanks again. Have a lovely rest of the night.